Gentlemen, let's talk about something most men won't discuss openly, but almost every man over 50 wonders about. What really happens to your body when you go through a long stretch without sexual activity? Maybe you've been single for a while, maybe health issues have changed things, or perhaps life just got complicated and intimacy took a backseat. Whatever the reason, you've probably heard the phrase, use it or lose it, and wondered if there's any truth to it. I'm Dr. Jocelyn, a urologist with 12 years of experience, and today I'm going to give you the honest, science backed answer. And I promise you, much of what you've heard is completely exaggerated. But there are some real changes that happen, and it's important you understand them. Stay with me because by the end of this video, you'll know exactly what's myth, what's real, and most importantly, what you can do to maintain optimal health and vitality, whether you're sexually active right now or not. Before we dive in, tell us in the comments now your age and where you're watching us from. We are reading and replying to every single comment, so drop your comments below. Now, without any further ado, let's start by clearing up the biggest myths I hear in my office almost every week. Myth number one is if you don't use it, it'll stop working completely. Here's the truth. Your body doesn't just shut down because you've taken a break from sexual activity. You're not going to wake up one day and find that everything has permanently stopped functioning. Your tissues, your nerves, your hormonal system, they're all remarkably resilient. The human body is designed for adaptation and survival. While certain changes can occur during periods of sexual inactivity, the idea that everything will simply cease to function is a dramatic overstatement that causes unnecessary anxiety. Myth number two is if I go too long without sex, my libido will disappear forever. Again, not true. Yes, hormones and psychological factors play a role, but taking a break from sex doesn't doom you to a lifetime of zero desire. Your body is adaptive, and desire can and does return when circumstances change. I've seen countless men in their 60s, 70s, and even 80s who've had years long breaks from sexual activity. And then, when the right circumstances arose, whether a new relationship or improved health, found their desire returning naturally. Now, here's what is true. There are some real, measurable changes that can happen to your body during extended periods without sexual activity. These changes aren't catastrophic, but they are worth understanding so you can take simple, proactive steps to maintain your health. Let me walk you through the biology in plain language, no medical jargon. Your entire reproductive and urinary system depends on three things: blood flow, muscle tone, and hormone levels. Think of these as the three pillars holding everything up. When you have regular sexual activity, whether with a partner or by yourself, you're essentially doing maintenance work on all three pillars. Sexual arousal increases blood flow to the pelvic region. That increased circulation keeps tissues healthy, elastic, and well nourished. It's like watering a plant. The tissue stays supple and responsive. When you reach climax, your pelvic floor muscles contract rhythmically. These contractions are like a natural workout for those muscles, helping them stay strong and toned. Strong pelvic floor muscles are critical not just for sexual function, but also for bladder control and overall core stability. And finally, sexual activity interacts with your hormones in complex ways. Testosterone, the key male hormone, influences desire, energy, and even mood. Regular activity helps keep these hormonal pathways active and responsive. Now, I know some of you are thinking, okay, so what actually changes if I'm not sexually active? That's exactly what we're about to cover. But first, quick pause. If you're finding this helpful, hit that like button, subscribe to the channel so you don't miss future content on men's health, and drop a comment below. Tell me, where in the world are you watching from? I love seeing this global community of men taking charge of their health. Let's break down the four most common changes men experience during extended periods without sexual activity. Change number one is blood flow and tissue health. The biology behind this is fascinating. Your penile tissue contains something called smooth muscle. This tissue needs regular oxygenated blood flow to stay healthy and elastic. During an erection, blood rushes into the tissue, stretching it and keeping it flexible. This isn't just about sexual function, it's about tissue maintenance at a cellular level. When you go for long periods without erections, and this includes nighttime erections, which are actually nature's way of doing maintenance, the tissue can start to lose some of that elasticity. Think of it like a rubber band that hasn't been stretched in a while. It still works, but it might feel a little stiffer at first. The smooth muscle cells can undergo changes in their structure, and the collagen fibers in the tissue can become less organized. This is a gradual process, not an overnight transformation. The practical reality is that some men notice that after a long break, erections might feel less firm initially, or it might take a little longer to achieve full hardness. You might notice that the angle of erection has changed slightly, or that maintaining firmness requires more mental or physical stimulation than it used to. The good news is this is usually temporary. Once you resume activity, blood flow improves and tissue responsiveness typically returns. It's not damage, it's adaptation, and adaptation can be reversed. The emotional impact of this change can be worrying the first time it happens. You might think something is permanently wrong. You might panic and assume this is the beginning of the end. But understanding that it's a natural, reversible response to decreased activity can ease a lot of anxiety. Knowledge truly is power when it comes to men's health. Change number two is pelvic floor muscle tone. The biology here is straightforward but often overlooked. Your pelvic floor muscles, the ones that control urination, support your bladder, and play a role in erections and climax, benefit from regular contractions. These muscles form a hammock like structure at the base of your pelvis, supporting your internal organs and playing a crucial role in multiple bodily functions. When you orgasm, these muscles contract rhythmically, anywhere from 5 to 15 times, depending on the individual and the intensity of the orgasm. These contractions keep the muscles toned and strong, much like any other muscle in your body benefits from regular use. The pelvic floor muscles also contract during ejaculation, helping to propel semen. Without this regular workout, the muscles can gradually weaken. The practical reality is that when you're not sexually active, you might notice subtle changes in bladder control. Maybe you feel a slight urgency you didn't feel before, or occasional minor leakage when you cough or sneeze. Some men notice they have to get up more frequently at night to urinate. These changes aren't necessarily severe, but they can be noticeable and sometimes concerning. The connection between pelvic floor strength and urinary function is direct and significant. The good news is that pelvic floor exercises, commonly known as Kegel exercises, can be done independently of sexual activity. You don't need a partner or even arousal to strengthen these muscles. Simple, regular exercises can maintain or even improve muscle tone regardless of your sexual activity level. I'll give you specific instructions for these exercises later in the video. Change number 3 is testosterone and hormonal balance. The biology of this relationship is complex and not entirely understood, but here's what we do know. Testosterone levels naturally decline with age, typically by about 1% per year after age 30. However, regular sexual activity helps keep the entire hormonal system engaged and responsive. Some research suggests that men who remain sexually active tend to maintain slightly better testosterone levels, though the relationship is complex and likely bidirectional. What this means is that sexual activity may help maintain testosterone, but it's also true that higher testosterone leads to more sexual desire and activity. It's a feedback loop. The hormonal system doesn't operate in isolation. Testosterone affects not just libido, but energy levels, muscle mass, bone density, mood, and cognitive function. When testosterone declines, all of these areas can be affected. The practical reality is that during long stretches without activity, some men notice they feel less motivated, less energetic, or just generally flat. You might find it harder to get excited about things that used to interest you. Your workouts might feel harder, and muscle gains might come more slowly. Libido can decrease, which creates a cycle. Less desire leads to less activity, which can further decrease desire. This downward spiral can be difficult to break without intervention. The emotional impact of this change can be profound. This can feel like you're losing a core part of your identity. Many men tell me they feel less confident, less masculine. There's often a sense of mourning for what feels like lost youth or vitality, but understanding that this is often hormonal and therefore treatable can be incredibly reassuring. You're not losing your masculinity. You're experiencing a biological process that has solutions. Change number 4 is psychological and relational effects. The biology behind this goes beyond just hormones. Sex isn't just physical, it's deeply connected to mental health. Regular sexual activity has been linked to lower stress levels, better sleep quality, and improved mood, partly because of the release of hormones like oxytocin and endorphins during intimacy and orgasm. These neurochemicals create feelings of bonding, relaxation, and well being. They are nature's anti anxiety, anti depression medications. Sexual activity also provides a sense of connection and validation, especially in the context of a relationship. It's a form of communication, a way of expressing desire and being desired. It reinforces the bond between partners in ways that words alone cannot. The absence of this connection can create emotional distance and loneliness, even when partners remain physically present in each other's lives. The practical reality is that men who go through long periods without intimacy sometimes report feeling more stressed, more isolated, or experiencing poorer sleep. You might find yourself more irritable, more easily frustrated by minor inconveniences. If you're in a relationship, lack of physical intimacy can create emotional distance. Partners may start to feel more like roommates than lovers. Communication may become more transactional and less emotionally connected. The emotional impact of this change is often the hardest part. This is often the hardest part to address because it involves vulnerability and difficult conversations. Sex is about connection, vulnerability, and feeling desired. When it's absent, for whatever reason, many men feel a profound sense of loss. There's often shame around discussing these feelings, which compounds the isolation. Men are taught to be stoic, to not complain, to handle things independently. This cultural conditioning makes it especially difficult to reach out for support when facing sexual or relationship challenges. Here's the most important thing I want you to hear today. For most men, especially those who are younger or in their 50s and 60s with reasonably healthy hormone levels, these changes are not permanent. Your body is remarkably adaptive. When you resume sexual activity, whether with a partner or through self pleasure, blood flow improves, tissues regain elasticity, muscles strengthen, and confidence returns. I've seen this pattern countless times in my practice. However, if you're dealing with significant age related testosterone decline, or if you have underlying health conditions like diabetes or cardiovascular disease, the changes can be more pronounced and may require medical support. And that's completely okay. There's help available. Modern medicine has excellent options for supporting men's sexual health, from hormone replacement therapy to medications that improve blood flow to pelvic floor physical therapy. There's no reason to suffer in silence. Whether you're currently sexually active or not, here are 4 practical steps to maintain optimal health. Step 1 is to stay physically active. Cardiovascular exercise improves blood flow throughout your entire body, including the pelvic region. When your heart is healthy and your circulation is good, every system in your body benefits, including your sexual system. Strength training helps maintain testosterone levels. Research shows that compound exercises like squats, deadlifts, and bench presses, which use large muscle groups, can actually boost testosterone production. Flexibility works, supports overall function, and can prevent injuries. Even a brisk 30-minute walk daily makes a measurable difference in cardiovascular health and, by extension, sexual health. Step 2 is to practice pelvic floor exercises. You don't need to be sexually active to keep these muscles strong. Simple Kegel exercises, contracting and releasing the muscles you use to stop urination, can be done anywhere, anytime. Here's exactly how to do them. Identify the muscles by stopping your urine flow midstream. That's the feeling you're trying to replicate. Once you know which muscles to engage, you can do the exercises anywhere. Contract the muscles and hold for 3 to 5 seconds, then release and relax for 3 to 5 seconds. That's 1 repetition. Do 3 sets of 10 repetitions daily. You can do these while sitting at your desk, driving, watching TV, anywhere. Step 3 is to consider solo activity. Even if you're not in a relationship, maintaining regular sexual function through self pleasure helps preserve blood flow, muscle tone, and hormonal responsiveness. There's no shame in this. It's legitimate health maintenance. Medical professionals recognize masturbation as a normal, healthy part of sexual function. It provides all the physical benefits of partnered sex in terms of maintaining tissue health and muscle tone. Some men feel embarrassed about this topic, especially at older ages, but it's important to normalize it as a health practice. Step 4 is to get your hormones checked. If you're experiencing persistent low energy, decreased libido, or mood changes, ask your doctor to check your testosterone levels. A simple blood test can reveal whether your testosterone is in the normal range for your age. If levels are low, hormone replacement therapy might be appropriate and can dramatically improve quality of life. This isn't just about sexual function. Many men report improvements in energy, mood, mental clarity, and overall sense of well being when their testosterone is optimized. While most changes are normal and reversible, there are a few warning signs that require prompt medical attention. Sudden, complete loss of ability to achieve erections, even morning erections, could indicate a circulatory problem or hormonal crisis. Pain or discomfort with erections or ejaculation is never normal and should always be evaluated. Significant changes in urination, like severe urgency, pain, or blood in the urine, could indicate a prostate problem or urinary tract infection. Profound fatigue, depression, or other symptoms that interfere with daily life might signal a hormonal imbalance or other medical condition that needs treatment. Remember, erectile dysfunction can be an early warning sign of cardiovascular disease. The blood vessels in the penis are smaller than those in the heart, so they often show signs of reduced blood flow first. If you're having persistent issues, don't ignore them. They could be your body telling you something important about your overall health. Many men have discovered serious health conditions, including diabetes and heart disease, through evaluation of erectile dysfunction. I want to address something that doesn't get talked about enough: the emotional weight of these changes. Many men tie their sense of masculinity, confidence, and self worth to sexual performance. So, when things feel different, it can trigger deep feelings of inadequacy or shame. You might feel like you're becoming less of a man or that your best years are behind you. These feelings are real and valid, and they deserve to be acknowledged. Let me be clear: your worth as a man is not measured by sexual frequency or performance. Your body is doing exactly what bodies do: it's adapting to circumstances. And with the right understanding and sometimes simple interventions, you can maintain vitality and function for many, many years to come. Masculinity is about so much more than sexual performance. It's about character, integrity, how you treat others, the contributions you make to your community and family. If you're not currently sexually active because of circumstances beyond your control, maybe you're single or your partner has health issues, you haven't done anything wrong, and you're not somehow failing. Life happens, relationships end, health conditions arise, partners pass away. These are realities of life, not reflections of personal failure. What matters is that you take care of your overall health and stay informed about your options. So, bottom line, do you use it or lose it? The answer is not in the catastrophic way most men fear. Your body won't shut down permanently if you go through a period without sexual activity. But there are real, measurable changes that can occur: changes in blood flow, tissue elasticity, muscle tone, and hormonal balance. The good news is that most of these changes are reversible. With resumed activity, proper exercise, and sometimes medical support, function and vitality can return. The key is to stay informed, stay proactive about your health, and remember that you have more control than you might think. Whether through physical exercise, pelvic floor training, hormone optimization, or simply maintaining sexual function through solo activity, you can support your body's health regardless of your relationship status. Now, we want to hear from you. What questions do you have about men's sexual health? What topics would you like me to cover in future videos? Share your thoughts in the comments below. We love to hear them and learn from each other's experiences. If this video helped you, please hit that like button and subscribe to the channel for more evidence-based men's health content. And share this video with a friend who might be wondering about the same questions. Let's break the silence around men's health together. Thanks for watching, and I'll see you in the next one.